Good evening, everyone. My name is Liam Moore. I'm a staff member at the American Brain Foundation. Just want to welcome you this evening for Signs of Alzheimer's and Other Dementia with Dr. David Holtzman. Our host for the evening is John Pohlad. John serves on the American Brain Foundation's board of directors. He's an independent family office consultant serving families with needs surrounding multi-generational wealth transfer and family office administration. And prior to that, he has had a long history of directing investment management firms. John places great importance on philanthropic endeavors and focuses those efforts on military veterans causes, arts, community organizations, and healthcare initiatives. He's acted as a board member for Dogs for Our Brave, Folds of Honor Minnesota, Twin Cities Public Television, St. John's University, the Minnesota Landscape Arboretum, and as I mentioned moments ago, he currently sits on our own board. Please take it away, John.
Thank you for joining us. Tonight we're going to learn about signs of Alzheimer's and other dementia, including the importance of early detection, understanding symptoms, and recognizing risk factors, especially in light of the growing prevalence of dementia worldwide. Webinar events like this one tonight are opportunities to connect you with experts in various topics of interest around brain and neurological care. I invite you to put your questions in the chat at any time, and after the presentations, we'll try to address as many questions as we can in the Q&A. The American Brain Foundation funds research across the entire spectrum of the brain, knowing that brain diseases, disorders, and injuries are all interconnected. ABF is currently funding multiple research projects in dementia, including Alzheimer's, Lewy body dementia, and frontotemporal dementia. ABF cannot exist without support from donors. If you're so moved, please make a donation so that we can continue funding critical research and continue to host free webinars like tonight's event. You can give at americanbrainfoundation.org/donate or scan the QR code on your screen. Let's move into our topic of conversation, signs of Alzheimer's and other dementia, with our guest, Dr. David Holtzman. Dr. Holtzman is the Barbara Burton and Reuben M. Morris III Distinguished Professor, the Scientific Director of the Hope Center for Neurological Disorders, and director of the Knight Alzheimer's Disease Research Center at Washington.
Trying to get this off.
He is also the recipient of the 2003 Potamkin Prize, the highest honor in Alzheimer's research.
Can somebody please mute the calls and have the open mic?
Are we okay to go? Are we all there?
Yeah, please continue.
Okay. Dr. Holtzman and his lab's accomplishments include showing, in part, how the APOE4 gene, my apologies, I kind of got messed up there with the noise going on in the background, so if you can just stay with me here for a second. Developing cerebrospinal fluid biomarkers for Alzheimer's and advancing our understanding of how sleep affects amyloid and tau in the brain. So thank you, Dr. Holtzman, for joining us tonight. And I apologize that I didn't quite get my my description out perfectly. There was a little noise in the background.
No, it's a pleasure to be here.
So maybe I should start. Can you explain the key differences between Alzheimer's disease and other forms of dementia?
So the way I always explain this to people is that dementia simply means that there is a decline in someone's memory and or thinking that begins to impair their everyday life. But the syndrome of dementia can be caused by many different issues. It can be caused by diseases like Alzheimer's disease, which is the most common cause of dementia in the United States, but there's many other both diseases and other things that can lead to the syndrome of dementia. Some of the other common causes, in addition to Alzheimer's disease, include having vascular damage to the brain, or strokes can cause dementia. Lewy body dementia is a kind of like Parkinson's disease that goes into, the pathology goes into some areas of the brain that affect both movement and thinking. And then another relatively common cause is called frontotemporal dementia, which affects language and behavior. So those are just a few of the many things that can cause dementia.
Okay. Yeah, and I have a number of family members who have been afflicted by these brain diseases, and the following is a great question because it's something that my family struggled with. What are some of the earliest signs of dementia that people should look out for?
Right. So it depends a little bit on the cause. So because Alzheimer's disease causes or contributes to about 70% of people over the age of, say, 65 that develop dementia, the most frequent presenting symptoms with that problem is usually problems with memory, sometimes with word finding as well. So that would be the most early symptom that we frequently hear from family members that a person might be experiencing. But with some of the other causes of dementia, it can be other symptoms that people present with, like trouble with word finding, language, trouble getting words out. It could be trouble with visual spatial problems, like where you're located, getting lost. It could be troubles with changing of personality. So it really depends on what the cause of the dementia is as to what symptoms you observe first. But with Alzheimer's, it's usually, but not always, memory impairment is the first thing.
Mm-hmm. And how do the symptoms of Alzheimer's progress through different stages, and what should caregivers be prepared for at each stage? Because the caregivers obviously, it's a fair amount of stress there on top of everything else.
So in the case of Alzheimer's disease as a cause for dementia, from the onset of the initial symptoms, let's say it happens to be in a particular person, trouble with recent memory. That stage when that happens is usually that's the only thing that's perceived for, let's say, a year or two without too much other issues. And people at that very early stage, sometimes we'll call that mild cognitive impairment stage of the disease or a very mild dementia stage of the disease. People can be still doing most of the things they normally would do. Very mild stage lasts about, on average, it varies by person, but 2 to 3 years. And there's one way to think about it. There's sort of 4 general stages of Alzheimer's disease: very mild, moderate, and severe. If you averaged out everybody who has the disease from the very mild to when one dies from the disorder, on average is about 10 to 12 years. So each stage typically lasts about 3 years. No, that's an average. It can be quite variable, though.
Yeah, sure can. My sister passed away last year at the age of 63 from frontotemporal. And it's very interesting. It was interesting to see that was much shorter than that time frame.
Right. And it turns out most of the diseases that cause dementia, if they start earlier in life, they tend to be faster. You'd think that wouldn't be the case, but that is
interesting. Interesting. Okay. And of course, this is something that I want to hear about. What lifestyle changes can we make to potentially reduce the risk of developing dementia?
Yeah. So I think there's a lot of things that one can do to decrease risk. I don't think, many, but not all of the dementias are highly genetically influenced. So I think the thing about lifestyle factors, though, is that while they may not be able to, if you adhere to good lifestyle, and we'll go over what that is in a moment, it doesn't mean you won't develop a dementia, but it probably means that it could potentially delay the onset by quite a bit of when you might get the disease if you otherwise didn't follow certain lifestyles. So, I mean, one thing is just good cardiovascular health recommendations are for sure important. So Mediterranean style diet, staying, not being obese, staying physically active, all those things are helpful for heart. They're good for your brain, for sure. There's a lot of evidence that if you don't get good sleep, that can also accelerate your risk for getting dementia. And so some of the common things that occur as we get older in a lot of people are things like sleep apnea. So if that happens, it's important to get it evaluated and treated. There's a whole other reason, a number of reasons why one might not get good sleep as well, that one can try to, mitigate those things that lead to poor sleep, like going to bed, at a regular time each night. Of course, not drinking too much alcohol. It was sort of common sense, but it turns out that the science behind this is actually showing that if you do get appropriate levels of sleep, probably in mid and later life, it can definitely delay the onset of disease.
Okay. And, I was just curious, and this is, it was interesting when you said Mediterranean diet. What does that mean? I'm curious.
Yeah, so not high in red meat. A lot of vegetables, things like olive oil, fish. All those things are all things that are typically you'd think of if you eat at a Mediterranean restaurant, are generally things that are quite healthy. Yeah.
Okay. Fantastic. Okay, and so right now, what are the current methods used to diagnose Alzheimer's and other dementias, and how accurate are they?
So I think one of the things we've learned about all of the disorders that cause dementia is that they don't start when people first show symptoms. In the case of Alzheimer's disease, the disease starts about 20 years before that. And then the pathology that's in the brain that leads to the symptoms that you see later builds up slowly regularly over a 20-year period. So by the time you're actually symptomatic, it's not really the beginning of the disease. It's actually more than halfway through the process of the disease. The reason I say that is that, and this is really why right now it's important to diagnose people clinically as soon as possible. And for one, you want to make sure that you know what is wrong. But two, finally, there is a medical treatment that seems to slow the progress of Alzheimer's disease, but it can only be used in the earliest symptomatic stage of the disease. And the earlier that it's detected, it looks like the more effective that the treatment is. So people that are watching this probably have heard of the approval starting about a year ago already of an antibody called lecanemab or Leqembi, which removes amyloid from the brain, which is one of the proteins that builds up in the brain in Alzheimer's disease. And then there's another antibody called donanemab that will be approved very soon. And these things remove amyloid. And it turns out in the clinical trials and the follow-up of patients who were treated with those antibodies, the earlier that you started the treatment, the better people do on average. In other words, the decline that is slowed down is slowed even more if you're started as soon as you can after symptoms emerged.
Interesting. So if you have I'm 59 years old. If I have a genetic predisposition to one of these diseases, is there a preventative? In other words, do you have to be showing symptoms before you can be eligible to treat it?
You do now, but there are two very large trials that started several years ago for people that, let's say, like yourself, that's cognitively normal, we hope. You could get screened to being on a trial of some of these of the antibodies that were recently approved. One that was approved, so lecanemab and donanemab. There's large prevention trials where if you go into one of the testing sites that is doing this research, you can get screened, and if you're cognitively normal, then they determine if you have amyloid in your brain. And if you do, you can be in the trial to see if the antibodies will delay the onset of cognitive impairment. My guess is that they're going to be very strongly positive. That's just my feeling, given the fact that now that we know if you treat people who are mildly symptomatic, that it slows the disease modestly. And we know that pathology starts so many years before. I've always thought the earlier you started a treatment that removes that pathology, the more likely you're going to get a bigger effect. But bottom line is you can't get on those drugs right now from your clinician, but you can potentially enter a trial if it turns out you have Alzheimer's disease pathology and you're normal.
Okay. And so you talk a lot about patients, and you talk about the person who's affected by it directly. You know, we all know that some of the biggest struggles are those of the caretakers of individuals. I know it firsthand. So what are some of the biggest challenges faced by caregivers of individuals with dementia, and what resources are available to help them?
No, that's a great question. So I just got out of clinic this afternoon trying to address some of those same issues. So I think some of the things that are difficult sometimes for caregivers is that the person who is affected by a dementia sometimes will have reasonable insight into the problem that's occurring, but a lot of times the disease itself affects one's insight. And so that can be difficult because the person who's affected doesn't necessarily, it's not their fault, but they don't necessarily understand what's going on. And so they may have certain behaviors that occur, such as paranoia, or it could be other behavioral problems, and how the person who's taking care of them or lives with them deals with that is not inherently obvious to everybody. I mean, no one's trained necessarily to deal with somebody who's developing a problem like this. So some of the things that we utilize are separate than the medical visit. We will have our patients, if issues need to be addressed with family or friends that are working with a person, they'll meet with a social worker who's very knowledgeable about strategies to deal with, also with education for both the patient and their caregivers, with places like the Alzheimer's Association. And there's similar support groups that are through the frontotemporal dementia associations that are available, as well as Lewy body dementia, similar associations that people can get better education in addition to social work support that often is from the clinics or academic centers. Perhaps often have very good social work support for people.
Yeah. Well, to your point, many years ago, as Liam said, I was on the board of Twin Cities Public Television, and we produced a program called The Forgetting. And it was all about early onset, but it was also focused on the caregivers. Right. And it's a terrific program. If anyone has a chance to watch it, it was moving, but also instructive. It was very, very good. So we already kind of went through this, but can you share some of the latest advancement in Alzheimer's and dementia research that might give us hope? Or
Yeah, so compared to when I first started to study this in the late 1980s till now, the scientific understanding of all of the dementing orders was almost non-existent in terms of what we really understood. And now for Alzheimer's disease, frontotemporal dementias, which actually encompasses several diseases, Lewy body dementia, we know an incredible amount about the underlying causes. And so I think some of the exciting things that are occurring now, first I'll start with Alzheimer's disease, is that there are now effective ways to get rid of, there's two main pathologies that occur in Alzheimer's disease. One is called amyloid, the other is called tau. The amyloid starts very early in the disease, and now we have these effective ways to get rid of it, called these antibodies that remove the material from the brain. And there's advancements on even improving other ways to get rid of the amyloid as well that are moving forward, in addition to antibodies. But the other pathology that correlates in Alzheimer's disease with really the brain damage is the tau pathology. And there's really exciting ways that people are developing to also sort of neutralize the toxicity of that particular protein, including lowering the levels of it, using gene therapy approaches. And then I think the other exciting thing, which spans all of the dementias, is that we now know that there's a very strong inflammatory response in the brain that is linked to the damage in the brain. And that's true both in Alzheimer's disease as well as the other dementias. And there's one of the things my lab and other labs are really working hard now is to figure out ways to mitigate that inflammatory response using some of the same types of things people have developed to treat different forms of arthritis and cancer. And I think that once that is further along, I suspect that will also be another a good way to attack some of these diseases, especially for the symptomatic phase of the disease.
Mm-hmm. Okay. Somebody asked what the name of that program was. It's called The Forgetting, by Twin Cities Public Television and Public PBS. So, and this is, I don't know if this is exactly in your purview, but something also addressed by that program. But what are sort of the legal and financial steps that a family can take early on to prepare for the progression of dementia?
Well, I think one of the things is as everybody gets older, when everybody's fine and normal, it's super important to have a durable power of attorney for healthcare. For everybody should have one, because once something starts happening, if that's not in place, it can sometimes be harder to then get that done. It still can be done once somebody starts getting dementia, but the potential caregivers of anybody or people responsible for need to be in place so that the appropriate decisions can be made, that the person themselves already know that they would trust a particular person to handle if they can't.
Mm-hmm.
And obviously, because a lot of times, as I talked about earlier, insight can become quite abnormal, even early in disease. It's super important to have a durable power of attorney for healthcare.
Mm-hmm. Okay. From my experiences, there's a lot of misconceptions about Alzheimer's and other dementias that you encounter. How can you address those misconceptions?
I think it's just like almost anything, whether it's healthcare or this topic or others, is as much education as possible. One of the things that we've encountered, I started many years ago doing what are called biomarker studies in people, where one of the ways to, in addition to obtaining blood to develop tests that in the blood that might detect Alzheimer's, which now there are available actually. But at the time, we didn't really know how to have good blood tests to detect Alzheimer's. But now, at the time, we were using spinal fluid tests. And a lot of people, when I started this program, a lot of it was doing research in people as they age that were normal. And so we had to convince people through education that, in fact, like getting a lumbar puncture spinal tap is actually a very safe thing. And you do explain in people from diverse cultures who were scared because of good reasons before, why would one get something that's so potentially damaging at a big academic center where that's not where we want to go. We don't trust those people. But I think through education and really reaching out to communities, I think one of the things that's happened when I first started seeing patients many years ago, most of the people were not coming in at the beginning stage of the disease. They already were pretty affected. But I think through education, through not just researchers, but through the Alzheimer's Association, through other groups, people are now generally more aware and they are coming in much, much earlier than they ever did before. So I think education can make a huge difference.
Okay.
And taking the time to really talk to people.
Mm-hmm. Okay, well, maybe what we should do is invite the audience members here to ask questions, and so I invite anybody to let it go.
You want people to unmute, or you want to ask them, or?
Well, I don't have access to the questions, so maybe Liam.
So they're in.
Yeah,
I can leave them in the chat if you want, however you want to do it. Liam, do you want to?
Liam, could you read those?
Certainly. So there's the first question that came through is about elaborating more on the effects of sleep.
Oh, elaborating more, yeah. So there's been a number of studies. So one of the ways that we understand a lot more about all these diseases is by doing research not just in humans, but also animal model systems. And one of the things that my lab and a few other labs found starting about 15 years ago is that if animals that develop the pathology of Alzheimer's disease are given sleep deprivation before that occurs, it strongly exacerbates amyloid deposition in the brain, as well as later on some of the other pathologies. And if you improve sleep in the animals, it actually lessens the pathology over time. There's been some studies in humans that have shown that if you look at people who develop sleep disordered breathing or sleep apnea as they're older versus those who don't, that makes them more likely to develop dementia earlier, or it's associated with developing dementia earlier. So what we would say now is try to, because of these kinds of studies, try to develop good sleep hygiene if you don't have it already. Things like I mentioned before, having regular time you get up and go to sleep in the morning, stay active during the day so you are tired later on. And if you do develop a sleep problem, to get it evaluated and treated. And by far the most common thing people develop as they get older is sleep apnea. And sometimes it's more frequent in people if they're overweight, but it can occur in anybody, even if you're not overweight. So those are the things right now but there's other sleep disorders that people can develop as well that can get treated in different ways. So just trying to make sure if you do have a problem with sleep, getting evaluated and treated as early as you can.
Perfect. Thanks for that. There's another question here. Does mild cognitive impairment show on a brain scan?
Well, so mild cognitive impairment is just the syndrome where people develop changes in memory and thinking that's when at first, that's mild. It doesn't tell you what the cause of the impairment is. So it's a non-specific term, just means that you have impairment. Another way to describe that might be you have very mild dementia. So you're basically developing a change from your previous state clinically that somebody can detect, either the person, usually their family member. So because so many different things can cause mild cognitive impairment, you may or may not be able to detect on a scan any abnormality. So when somebody first, for example, is developing the first symptoms of Alzheimer's disease, you don't know what it's from when they develop their memory impairment. So you might say that person has mild cognitive impairment, but then you'd have to do other testing to prove whether that impairment is due to Alzheimer's versus something else. You can start developing mild cognitive impairment because you have depression or because you have a brain tumor. There's so many things that can cause mild cognitive impairment. So whether you detect something on a scan or not depends on what the cause of the impairment is.
Makes sense. There's somebody else here wondering where testing centers are located.
Just in general, or that's what
I think in general, the question is, where are the testing centers located? And this is in reference to much earlier in the discussion.
Well, maybe the question had to do with clinical trials. So the prevention trials that I had mentioned that are ongoing right now with some of the antibodies, most of the major academic medical centers in the United States, so you're in Minnesota, so the University of Minnesota, Mayo Clinic, but in any of the states, the major academic medical centers are sites generally for the major trials, including the ones I mentioned. One way to look this up, the trial called the AHEAD trial, that's for the lecanemab antibody as a secondary prevention study. That you can look up on the internet, just search A4 AHEAD study, and you'll find that it's actually A34. It's the AHEAD study. They're still enrolling for that, and they want to try to complete enrollment soon, so that's still available. And then the trial done by Eli Lilly with their antibody called donanemab as a secondary prevention. You can also look that up by probably just searching on the web. And I think most of the major academic medical centers are sites for those trials.
Perfect. Thanks for that. There's Pretty. There's a question here that says, can Alzheimer's be reversed?
Not that we know of at this time.
And at a future time?
That's a great question. I think I'm optimistic that if we detect the disease before it becomes clinically manifest, that it could be delayed and or possibly prevented. Markedly delayed, like basically, you hopefully could be old enough that then you hopefully have something else that you die and never get dementia. But and that's probably true for some of the other dementias as well. But whether you'll be able to reverse the dementia, I mean, I can't say it's not possible. I mean, I don't know. Maybe if you completely got rid of the underlying pathologies, which it's certainly conceivable one could get better. There's actually one of the good examples of this so far is that in another neurodegenerative disease, not a dementia, but in a rare form of amyotrophic lateral sclerosis, ALS, Lou Gehrig's disease. There's a rare form caused by a particular genetic mutation in a gene called SOD1. And recently there's a treatment where you can lower the gene product for that causes that rare form of ALS. And it was recently approved for treatment by the FDA. Some of the people that were pretty impaired already by weakness due to ALS with that particular treatment started getting better very clearly. So if that could happen for that disease, which is a terrible and rapid disease, I would think that for these other diseases that there's good hope that you could potentially get people better if you're hitting the root of the disease.
Yeah, just a couple of months ago, we had Dr. Merit Sikovich join us for an event all about ALS, and she talked a bit about the kind of exciting progress that's been happening in SOD1 or SOD1 ALS. So very, very interesting stuff. The recording is on our YouTube channel if anyone wants to check it out. Another question here, is amyloid a response to inflammation in the brain?
That's an interesting scientific question. I would say we don't know that for sure. It's certainly one of the things that happens is when the amyloid protein deposits in the brain, when it first starts depositing, there's an immediate inflammatory response in the brain around it. So we know that inflammation can respond to amyloid depositing, but I don't think we know for sure whether inflammation is causing the deposits to occur. There's some studies that might suggest that, but I don't think we know that for sure yet.
Someone's wondering, they say, although Alzheimer's disease begins 20 years before symptoms are experienced, is the only reason someone can look into their risk or want to know medical treatment to slow progress, the individual would have to have a genetic risk factor and no other factors? I'm not entirely sure what this question is asking, but I think they're just wondering about risk factors other than genetics, or why somebody might want to look into their own risk for Alzheimer's.
So what I think is going to happen in the longer run, meaning the next, not that long run, maybe in 10 to 15 years from now, is that once we know that you can, if some of these new treatments that are being tested, like antibodies to amyloid, that if they actually delay the onset of cognitive decline in people that are normal, I suspect what's going to happen is that you will be able to go into your doctor's office, get a blood test when you're normal, and determine if you have amyloid in the brain or not. And if it's negative, you probably come back 10 years later and test again. But if it's positive, I suspect, regardless of your genetics, you could probably start getting on some sort of treatment to halt it or remove it. That's what I think will happen in the future. Right now, if you wanted to find out the biggest genetic risk factor for Alzheimer's disease is ApoE genotype. You can get tested for that by yourself, not typically through your doctor, but you can go to 23andMe and they can They can test your ApoE form if you want to know what it is. The problem with that is that it doesn't tell you for sure that you're going to develop Alzheimer's disease. It tells you that you're at higher risk. So, I mean, some people want to know that, and that's their prerogative. But if you're going to do something different about knowing that result, I think that could be helpful for some people. Some people, I mean, another way to approach it is if you would already try to act in a disease prevention way regardless, then it wouldn't probably help to know unless you just need in your own mind to want to have that as motivation to act differently.
Sure. And we should all be sleeping
Right.
8 hours a day and eating a Mediterranean diet anyway.
There you go.
Question here. There's a couple of questions. One on, is there any relation between dementia and Parkinson's? And then slightly related, a question about LBD. And, if is there new medication or new diagnostics for LBD?
Yeah, so those are both good questions. In Parkinson's disease, many people over a 15 to 20 year period after they develop Parkinson's will also develop dementia. Sometimes it's due to also getting Alzheimer's disease. Sometimes it's just due to the Parkinson's pathology spreading to parts of the brain that control thinking. So it is pretty common for that to happen. Lewy body dementia is kind of like it's almost like another form of Parkinson's, where the pathology isn't just in the part of the brain that controls movement, but it's also in the thinking parts of the brain. So there aren't yet treatments to attack the underlying disease process of Parkinson's or Lewy body dementia, but there recently emerged in the last 1 to 2 years what looks to be a pretty accurate test that can determine whether or not you're developing what's called synuclein deposition in the brain that occurs in both Parkinson's and Lewy body disease. So that's good news that there's now going to be a test that can be more definitive about whether you have synuclein pathology that underlies those diseases.
Gotcha. You spoke about different stages of Alzheimer's earlier. Can you elaborate on that?
Yeah, so it's as the different pathologies of disease get more and more advanced, you move from being very mildly impaired to mildly impaired to moderately impaired. So the different stages in very mildly impaired people, they typically can still do things mostly on their own. They don't need too much assistance from others. The mild stage would be where somebody can still carry out many of their activities of daily living, but not at the same level, and they do need assistance with some things. The moderate level of impairment needs where somebody needs to pretty much be around somebody most of the time, because people could get into trouble if there's not somebody around them. And the severe stages where somebody needs either full-time care to be in a living situation that's like a nursing home or assisted living or memory care situation to be safe.
And is there a rough timeline that usually happens? Does it advance pretty regularly for most people, or differently for everybody?
A lot of it depends. So the average stage length of each of those stages is about 3 years on average, but those can be longer or shorter. And a lot of it depends on whether let's say somebody has Alzheimer's disease as a cause. It's also frequent as you're older to get other things on top of that can make it faster. And if you don't develop some of like, for example, you could have Alzheimer's disease, but then you develop some strokes. Well, that then makes the brain disease go faster. Like what you see as symptoms go faster in signs. Sure. Or sometimes people get Alzheimer's disease and Lewy body dementia together at the same time. And so then those people, they generally go faster from stage to stage. So it really depends on what other health issues are going on as to how long the stages last.
Sure.
I've seen Alzheimer's disease last 20 years.
Mm-hmm.
In somebody who is otherwise very, very healthy.
Sure. There's a question about what a diagnosis of Alzheimer's entails. And so I think, it might depend on the stage, but yeah.
Well, so nowadays, it's changed recently, but essentially, based on the most useful thing I found as a clinician is when I take the history about when I see a patient, I always will see them also with either a spouse or a close friend or a family member, and I will interview that person first. And based on the history of if a person knows the person affected well, just based on that history, I can be pretty accurate as determining whether the person, what problem they likely have. And then by seeing them and getting some neuropsychological testing, that can help me verify whether I think the disease is Alzheimer's or Lewy body dementia or frontotemporal dementia. But to be definitive, 100% more, really 100% definitive for Alzheimer's disease, you also need to get testing to determine whether they have the pathology of the disease in their brain. And as I said, it used to be that you could get spinal fluid testing that would be very, very definitive. But now you can get amyloid imaging, so a PET scan that can detect the pathology. And most recently, some of the blood tests that have been developed are just as accurate. Now, they're not yet FDA approved, but they soon will be. I was very involved in development of some of the blood tests, and some of them are just as accurate as the spinal fluid test to determine whether or not you have amyloid in the brain. So if you have the typical clinical syndrome and you get one of these tests to confirm that you have the underlying pathology, then we can be, very, very definitive about what's causing the disease.
Great. Someone wants to know, speaking of the pathology, if you could elaborate on amyloid and tau in simple terms. Could you explain these proteins to us like we're school children?
So our body and our brain makes thousands of different proteins. And unfortunately, as we get older, a small subset of them, instead of being produced and then removed over time, they can do what's called misfold. So instead of being a normal shape, so think of it like this: if you have a bunch of sugar in water, and even at a high concentration, you can get it to dissolve by stirring it or heating it. But if the concentration of the sugar is too high, you can't get it all into solution. And that's what happens with some of these proteins like the amyloid protein. Normally, it's soluble. It doesn't build up. But as we age and other factors start to occur, the protein starts to come out of solution. And then it builds up in the brain when that happens. And once that happens, it's kind of inexorably just starts building up, building up, building up. It's kind of like salt that builds up when it comes out of solution. It just crystallizes, and then it starts building up, building up. That's the problem with most of the neurodegenerative diseases, is that certain proteins, different ones in different diseases, build up in the brain, and the brain can't get rid of them. And then those proteins start damaging the brain. So same thing with the tau. So amyloid in Alzheimer's disease starts building up over years. And then as the symptoms begin to start, it somehow leads to this other protein building up called tau. And then when that happens, people start becoming impaired. So these proteins that build up, they're toxic to the cells around them. And they can cause the cells to die, the nerve cells to die. So that's a simple way I hope that's a simple way to think about it.
I think that makes sense. I know this was an analogy, but someone is wondering about the actual effects of real sugar.
Oh, no. That's a different issue. I didn't mean to say, yeah.
No,
I mean, one of the things that, since sugar was brought up, is that it's very clear that if you have diabetes, it puts you at higher risk to get Alzheimer's disease. So you certainly want to control your diabetes as best you possibly can if you do develop that.
Right. You said that tau somehow results after amyloid, right?
It generally does, and it doesn't start building up to high levels until, in Alzheimer's disease at least, until after amyloid has been building up for a while. So we have good evidence that somehow the amyloid is driving over years the development of the tau pathology.
Interesting. And then so other, I know that there are tauopathies,
Right.
that are purely tau diseases, right?
Correct.
Like,
certain forms of frontotemporal dementia, like Pick's disease, or a progressive supranuclear palsy is another disease. Right. Those are primary tauopathies. So in those rare, they're not very common, but that's where tau builds up alone without amyloid needing to be around. Sometimes they're genetically driven, sometimes not. So,
gotcha. A couple of questions here about other, brain diseases, disorders, injuries. So you had mentioned sometimes that strokes can exacerbate Alzheimer's. This person is wondering, does suffering from a lifetime of complex PTSD, OCD, anxiety disorders damage the brain or predispose one to dementia? Another person wondering if a single concussion can cause Alzheimer's disease.
I think there's a lot of evidence that's stress due to a lot of things chronically can be a risk factor for Alzheimer's disease. I don't think we know enough about, how much is that. It probably varies by person and cause, but it probably puts you at higher risk. I think that's one thing that's come out from research on this topic. Now, there are studies that suggest that if you've had significant head trauma, not just a mild concussion one time, but significant head trauma, that you're at higher risk later on in life to get Alzheimer's disease. But it's not clear that a single concussion alone without serious brain injury is likely going to put you at higher risk.
Sure. We have a couple of people with their hands raised. I took away people's ability to unmute themselves earlier, so I'm going to see if we can make this work. Kathy, are you able to unmute?
Yes. I've heard that Alzheimer's is a type 3 diabetes. Any thought on that? Thank you.
Yeah, so this will have to be a little bit of a scientific answer. I don't particularly like that terminology, but the reason some people came up with that is when some of the ways that a molecule like insulin works when you get diabetes, it acts on certain receptors in, for example, in the muscle to help your cells take up sugar and utilize sugar better. In the brain, some of the same receptors appear to become abnormal in Alzheimer's disease, but it's a completely different process. I don't think that's really a good term, but some of the signaling pathways, the way that cells communicate with each other in the brain, become abnormal in Alzheimer's disease. And some of those abnormalities appear to mimic some of the changes that occur in peripheral cells in diabetes. So that's why they came up with that term, but it really is a completely different issue.
We got another person here. CM Einders. Are you able to unmute yourself and ask your question? If not, we'll move on. Let's see. A question about testing we already covered. This is a question about brain metabolics and the importance of ketones on mitochondria. This is about social media type discussions. I think, personalities, social media personalities talking about these kinds of things.
Yeah, so there's a lot of evidence that in the neurodegenerative diseases, inside our cells in the brain, and other cells in our body, mitochondria are the part of inside the cell that generates energy. And there's evidence that there is mitochondrial dysfunction in diseases like Alzheimer's disease. So people have thought if they can get another source of energy, such as ketones, that might be a way to, decrease the effects of a disease like Alzheimer's. There are companies and others that have explored trials of using different diets that are high in ketones to see if this might be helpful. I don't think it's proven yet whether it is or it isn't, It's actually in a rare childhood form of epilepsy. High ketone diet can be very helpful in suppressing epilepsy. But in these diseases we're talking about today, I don't think there's yet strong evidence that that we should be taking those diets. It's fine to do trials, but we don't know the answer of those trials yet to say it's worth doing that.
Sure. Can omega-3 assist in lessening tau buildup?
There's some studies in animals that suggest that, but it's never been tested in humans.
Right. Question about cardiovascular diseases and whether those increase risk. I assume it's a similar answer to.
Yeah, I think the main thing with strokes, for example, is that they don't necessarily worsen the pathology of Alzheimer's disease in the brain, but when you have one pathology causing brain damage, and then you also add on another cause of brain damage, you add those together, and it's usually worse. So that's the issue.
It looks like C. Minders was able to unmute themselves. Are you able to hear me and talk?
No, I don't have a question.
Okay.
All right. Well, put you back on mute then. Thank you. All right. Question here about if you go to be checked and they find that you have dementia, is your doctor going to report this so that you can't drive a car or do other things like that?
Well, that's a really good question. And unfortunately, it completely depends on your state that you live in. So I don't know about all the states, but in the state of when I was in California years ago for my training, you were required if you diagnose somebody with dementia, you were required, and I think this is still the case, I'm not sure, you were required to report the diagnosis to the DMV of the state. Now, that didn't necessarily mean they were going to take your license away, but it probably meant that they would test the person as to whether they thought they were still fit to drive.
Sure.
Where I am in the state of Missouri, you don't. If for example, somebody is just developing the initial symptoms of, let's say, Alzheimer's disease, and if I think that the person, based on the history from their family and them, that everything is still completely fine with driving, then I don't have to report them. Sometimes if I think somebody might be developing a problem, even though they don't say it, I will often have them tested, not by the DMV, but by occupational therapist who does drive testing to make sure that they're still, both competent and safe. But it is required in our state if you think somebody is dangerous and they won't stop driving, then we are required to report it.
Interesting.
So it's up to the discretion of the clinician.
Okay. Current research concluded that the keto diet can cause aging of cellular parts of the body like liver and heart. Do you have a take on that?
I don't yet for the brain. So.
All right. Keto diet. Who knows? Is there an association of dementia to rapid eye movement disorder? I know that there is one to Parkinson's and LBD, but
right. So REM sleep behavior disorder, where you act out your dreams while you're still dreaming, is frequently seen years before people have abnormalities due to either they'll often develop then Parkinson's disease later or Lewy body dementia. So, but it's usually not seen before Alzheimer's disease. It's seen before those two disorders. There's a very large international study that's headquartered at my university, at Washington University, with sites all around the country that is studying people who develop REM sleep behavior disorder, but they're still normal, cognitively normal, to try to figure out more about if that's a prodromal syndrome, can we develop ways to ultimately start preventing the onset of the other disorder afterward.
Okay. One final question here. If you have had an amyloid lesion, localized type, I think, is this amyloidosis maybe? Could that predispose you to amyloid in the brain?
Yeah, there's different proteins in our body can form what's called amyloid. So, for example, there's some diseases where a protein forms amyloid in the heart and causes the heart not to function properly. And actually, it's a pretty frequent cause in late life of heart failure. That's a completely different protein than builds up in the brain of the amyloid in Alzheimer's disease. They're not related to each other. So if you develop the amyloid of Alzheimer's disease in the brain, it doesn't build up in other parts of the body. Vice versa, if you develop one of the other diseases of amyloid in the body, that doesn't cause it to build up in the brain. So it's not associated with this. They're different.
Sure. Perfect. Wonderful. That's all the time we have for questions. I'm going to pass it back to John Pohlad to take us out. And you're on mute, John.
Oh, still mute.
There we go. Are we back?
Yep.
We've got
Okay.
you. Thank you.
All right, thanks. Thanks for the save there, Liam. So thank you all very much for coming. These are all very important issues, and luckily we have Dr. Holtzman here to give us all the answers. And we appreciate that very much. ABF hosts these webinars regularly, and we'd love to see you again there. The next event will be on July 9th on how stress affects the brain with Doctors Teshime Monteith and Jeffrey Iliff. So we'd look forward to seeing you there, and thank you very much. Appreciate it.